Hi, we're the Parkland Dental Hygiene students, and today we'll be discussing about the continuous passive airway pressure, also known as the CPAP machine, and how it relates to the oral health. A few things we'll be discussing today are signs of obstructive sleep apnea, systemic health problems caused by obstructive sleep apnea, risk factors by obstructive sleep apnea, what a CPAP machine is and what it's used for, the side effects and oral conditions associated with the CPAP machine, and how to properly maintain and clean your CPAP machine.
Signs of sleep apnea include morning headaches if the patient is obese, having sleep problems if unable to concentrate, having a feeling of irritability or depression if you wake up throughout the night having a sore throat, neck circumference greater than 17 inches, nasal congestion during the night, having large tongue, a long soft palate, or bruxism. There are several health problems that is caused by sleep apnea, such as arrhythmias, atherosclerosis, congestive heart failure, coronary artery disease, diabetes, hypertension, pulmonary hypertension, and stroke. It is important to know the signs and symptoms of sleep apnea to decrease the risk of having any of these systemic issues. Some risk factors include having a narrow palate. This can reduce the space of the tongue and cause crowding, which reduces the nasal space, enlarged uvula, tonsils, and adenoids. In dentulous patients, a patient missing teeth can lead to pharyngeal soft tissues to collapse. Xerostomia or dry mouth, and obesity. 70% of patients who have sleep apnea are obese. There are questionnaires and oral assessments that can help identify if a patient is at risk for sleep apnea. One is Epworth Sleepiness scale, gives the patient a situation to see how likely they are to feel tired or most likely to fall asleep in these situations. This test is on a 0 to 3 scale level. 0 would be a no chance at all. 1 is a very slight chance, 2 a moderate chance, and 3 a high chance. The next assessment is called the stopping risk assessment. This asks the patient a variety of questions that could contribute to sleep apnea. 4 of the questions are: do you snore loudly? Are you tired during the day? Has anyone observed you stop breathing while sleeping? And do you have a high blood pressure? If the patient answers yes to 3 out of the 4, continue on. Is your BMI greater than 35 kilograms? Are you age 50 or older? Is your neck circumference greater than 17 inches? And are you a male? If any of these answers are yes, the dentist should refer the patient to a physician specializing in sleep disorders.
CPAP is a treatment that uses mild air pressure to keep your breathing airways open. The CPAP machine consists of a tube that connects to a securely strapped mask or device that covers the nose or both nose and mouth, which is connected to a motor that blows air into the tube. The machine increases air pressure in your throat so that your airway does not collapse when you breathe in. This is generally used to treat sleep-related breathing disorders such as sleep apnea. Another treatment condition can be preterm infants who have undeveloped lungs.
Common oral side effects associated with the use of a CPAP machine are dry mouth, halitosis, and bleeding gums. The most common and harmful side effect is dry mouth, which we will be focusing the most on in this video. What are the signs and symptoms of dry mouth? A dry, sticky feeling in the mouth or throat, difficulty chewing, swallowing, tasting, or speaking, a burning sensation in the mouth, a dry, rough tongue, cracked lips, bright red gums, mouth sores, and bad breath. It is important for caregivers to look out for these common signs and symptoms of dry mouth to prevent discomfort or further problems in the patient. What can dry mouth cause? Patients suffering from dry mouth can experience difficulty with eating, swallowing, speaking, wearing dentures, trauma and ulcerations of the oral mucosa, taste alteration, poor oral hygiene, a burning sensation of the mucosa, oral infections including candida, and rapidly progressing dental caries. Dry mouth is a leading risk factor for cavities due to the insufficient amount of saliva washing over tooth surfaces and flushing the food and debris out of the mouth. What can you do to help? There are many products on the market today to help with dry mouth. You can use Biotene as a morning mouth rinse. Another great option is Xylomelt. They are placed in your mouth while sleeping during the use of a CPAP machine to ensure a moist mouth upon waking up each morning.
Why should you clean a CPAP machine? If you find that you're getting sick more than usual, a dirty CPAP could be the culprit. That's because CPAP equipment is a breeding ground for bacteria and germs. When first given the CPAP machine, The dentist should provide instructions on cleaning and proper use. Each device is not the same and may have different proper cleaning instructions. For a general idea of how to clean the CPAP, techniques to avoid include: don't use toothpaste, which could be abrasive; avoid boiling water, which could cause distortion; don't bleach your device, which could break down and cause poor smell and taste; and prevent breakage, use a washcloth such as a cushion when cleaning. The proper way to clean the mask and tube would include: warm water and liquid dish detergent, soft brush used only for cleaning the device, ultrasonic cleaner, which helps clean the smallest spots, manufacturer's cleaning products tested and tried true to the product, protect your investment, and the SoClean, which is a self-cleansing system. Here are some tips and tricks. So for daily cleaning, if you've been sick, it is best to wash your mask, tubing, humidifier, and filter daily until your cold or flu and symptoms are gone. Wipe down your mask with a damp towel, mild detergent, and warm water. Empty the humidifier unit, letting it dry out. Here are some weekly cleaning tips. For healthy patients, the humidifier should be cleaned weekly. Clean the CPAP tubing, nasal mask, and headgear in a bathroom sink filled with warm water and a few drops of ammonia-free mild dish detergent. Swirl all parts around for about 5 minutes. Rinse well and let air dry. Clean the filter by rinsing it under warm tap water, squeeze it out, and blot it dry on a towel. Here are some more tips and tricks. Make sure to use distilled water only. Replace the white filter once a month. Hang the tube to dry on a hanger or hook. Replace the mask and tube about every 3 months. And replace the headgear and straps every 6 months.
Thank you for listening to our video on the uses of a CPAP machine. I hope you found this information useful.